Good morning and welcome to Houston Newsmakers. The news coming out of Washington this past week was good news for those who support the community health organizations. I do this because as we tape this program, the proposal from the Senate was to extend funding for the Children's Health Insurance Program by another 2 years on top of the 4 approved earlier by Congress. What happens when the dust is all settled remains to be seen, but at least there appears to be an increased effort to get funding to these centers that serve 1 out of every 12 Americans. I'm not talking about the CHIP, I'm talking about community health centers. With me this morning are 2 people who are in the trenches of our communities, providing health care services to the underserved in our communities. Katy Caldwell is CEO of Legacy Community Health, which started in 1978 as the Montrose Clinic, serves more than 150,000 people each year. Janda, President and CEO of Community Health Choice, which has been in business more than 20 years, has seen its revenue doubling in the past number of years as the need has grown. Good morning to both of you.
Good morning.
Good morning. How important is the community health organizations? How important are they in general? I get the sense that a lot of people really may not be aware of what your organizations do. Talk about that.
So we provide primary care, dental care, behavioral health, and vision services to anybody who walks in our doors, and we charge a sliding scale based on people's ability to pay. And one of the reasons we're so important, especially in Texas, is we still have the highest rate of uninsured people in Texas, and without the community health centers, we're the backbone of the safety net. We actually hold the safety net, is the way I usually say it, and we're there for people who really don't have anywhere else to go, or can't, or fearful of going other places. We also keep people out of the emergency rooms. We keep people healthy. We keep them helping them take their medication, giving medication at a discounted rate. So without this funding and the authorization from Congress, we would be closing doors, laying off staff, and not seeing nearly the number of people that we do every year.
Ken, I'm assuming your organization does similar things. How are you different, and do you share the same kind of feeling about this funding and how important it is to you?
Well, we're the health plan that finances a lot of what the community health centers do. So we don't actually see patients ourselves, but we're the health insurance for people on Medicaid, for the CHIP kids, for other low-income folks. And so the community health centers, like Legacy and the other community health centers here in Houston, are a big part of our network of doctors and that see our members. So as an example, we finance thousands of births every year that the doctors in Katy's clinics do the prenatal care for. And so they're a big part of the network that we use for people that have health insurance. And it's not just for people on Medicaid or CHIP, but it's also, as Katy says, anybody who needs health care services can go to one of those clinics.
How have the changes in the Affordable Care Act impacted the way both of you do business?
Well, the biggest thing is that people were able to buy health insurance at an affordable price. So we saw the number of people that were uninsured prior to the ACA significantly higher than now. And we had record enrollment in Texas this last year. So we have fewer adults that are uninsured. We still have a lot of adults that are uninsured, don't get me wrong. But that was, to me, the biggest impact of the ACA.
Yeah, well, it certainly impacted our business a whole lot. We have over 100,000 people who were previously uninsured in the Houston area who are now members of our health plan, and therefore if they do go to a Legacy or one of the other community health centers, we're actually able to pay them as insured members as opposed to having to be paid out of the uninsured pools. That is still a very important part of Katy's business.
This funding conundrum, that's the best way I could describe it right now.
It's a good way.
I have to imagine that you who do planning, you've got a plan. How does this impact the way you have to do business or plan for your future?
Well, we can't plan, or what we do plan is I have everything from, gosh, we're getting funding and everything's going to be great and we can continue to serve all the people we're serving and continue to expand, all the way to what I call the doomsday scenario, which is we lose all our funding, we have to lay off staff, close sites, serve less people, specifically less uninsured people than we have in the past.
But no one's really saying that. I mean, most people are saying that they have bipartisan support, and at least recently the lobbying efforts have really shown that there seems to be a bipartisan effort.
There is, and so it's just very frustrating to us who deal with the folks in Austin and Washington on these issues that there seems to be great support for what the community health centers do. There's great support for the children's health insurance program. Another one that's in this refunding package is actually the special needs programs for people who are dually eligible for Medicare and Medicaid, a disabled population. And everybody says, yes, yes, we're going to get it done, and yet we continue to have this back and forth with Congress about, how it impacts. Right. And it's not, some of these things actually save the government money. The CHIP program actually is a money saver. Other programs do cost some money, and yet there's great support for health care, but it always gets gummed up in the politics of Washington. It
does indeed, but you have to go through that in order to make sure the funding stream comes in. What's the best case scenario in terms of government funding and community support? What's the best case scenario?
Well, best case scenario is they don't shut down the government, and we'll, while this airs on Sunday, we'll hope that the government is open. And if the government's open, then the best case scenario is then community health centers are funded for the next 2 years. And so we can continue doing the work that we do.
So it's every 2-year cycle?
Yeah, and for me, it's even more than that. I think there's some of the things coming out of Washington that says that Texas as a state could have more flexibility in terms of how we do our Medicaid program. So I'm still optimistic that at some point we'll have a discussion in Texas about how we can cover even more people through an expansion of coverage for low-income people that are still what we call uncompensated care and have to be paid for through property taxes at the county level or some of the additional funding that comes to organizations like Katy. Coverage would actually be better for all Texans.
What advice would you give people who want to know, okay, what do I do? How do I get the best information I can about my health care and how I can best take care of myself and my family? What's the best outlet for them, you think?
Go to our website. Or go to Community Health Choices website, and you will see lots of choices on there. We have links both to making appointments at our location and links to places like Community Health Choice.
Is it easily understood?
We hope so.
Yeah. No, we actually try really hard to make it understandable, especially because we're dealing with a lot of low-income populations that may not have a strong educational background. We try to make things as simple as possible. The other thing that we're expanding our use of what we call complex care managers. And so for people with multiple conditions that really have big challenges, we have nurses, RNs, that will actually help guide you and be a navigator for you through the system if you're a member of our health plan. And I know that Katy has a lot of navigators too at her place that help guide people because it's a complex, fragmented system.
I'm glad you told me that because I'm going to make sure that I put that information for both of your organizations on my website. Janda and Katy Caldwell, thank you for coming in, getting this conversation going. Hopefully we've helped some people understand what they need to do about their health care. We appreciate you coming in this morning.
Thank you.
Thank you for having us.
That's going to be a Newsmakers page on click2houston.com, by the way. This is Black History Month, and my next guest has written about the influence of African-American women, specifically how women